All right. Evening, everyone. Thanks very much for making time. So for those of you I haven't met before, I'm Jake. I'm a pediatric hepatologist in Birmingham, and half my time's academic, half my time's clinical at the moment. And yeah, so I thought we would just chat through a bit about interviews from my very personal experience, and I hope it's useful. There's obviously a lot of different ways different people have opinions on these things, so take it or leave it. I know some of you have got interviews pretty soon, like this week, so I hope that this comes out as a overall positive thing rather than making you worry about what you've already prepared. So the way that we're going to do this will be, I've just got a few generic tips, and I hope you find them useful, and then basically we'll just run through a whole bundle of questions, and I will be looking for people to be willing to share their thoughts and ideas with me and answer some questions. Of course, I can do it myself and give you pretend answers, but that won't be nearly as useful. So I'll be very grateful if some people are willing to help out. So interrupt me at any point, just shout out and or put up your hand, put something in the chat, any of those, and yeah, we'll make it as useful as possible. So when it comes to actually kind of working at doing the interview, it is totally normal to feel like this, that it feels like everything is falling to pieces. Certainly I feel relatively okay until it gets to the day of the interview, and then suddenly I realize I am not okay. But the preparation does come through on the day. So the way I think about it is that there's two components. There's what you actually deliver, and then of course how you deliver it, and both are important. And unfortunately, like with all human communication, how you deliver something will influence what the interview panel actually hears. This will most likely follow what I would describe as the kind of standard NHS interview structure, but with some nuances. They almost all will have structured scoring, so specific questions and then marks allocated to those questions. There's rarely scope for follow-up questions, so if you leave something hanging, most of the time the panel is not allowed to ask you, well, tell us more about blah 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 blah. You know, that they would just leave it that you haven't told them, so they don't know. Sometimes they will have your CV, sometimes they won't have your CV or application in front of them. I have to say, for the ones that I've done for clinical academic interviews, usually you do have the applicant's application in front of you. However, you may have been sent 40 applications, and I expect that the majority of people, unless they were involved in the scoring, will probably only read your application immediately before your interview in the 5 to 10 minute break between the two people. Maybe I'm just letting on here how unprepared I am when I do these things, but the crux of that is that assume that the panel know nothing about you and you have to say everything. Certainly in most NHS interviews, when we're thinking about nationalised applications for paediatrics, for example, you will not necessarily be working with the people who are interviewing you, so they're not looking for someone who's going to fit into their department. Of course, that's completely different to a consultant interview. That can be different for ACF interviews, and then it totally depends on the specifics. So, for example, my ACF interview was for East of England paediatrics, and that covered Norwich and Cambridge were the two main universities there, so there were people from both represented, and then across a whole different array of specialties, pediatric research subspecialties within. So there was no one on that panel who I was planning on working with. That may be different if, for example, you're applying to neurosurgery within one region and there's only one neurosurgery academic unit, and then therefore you are literally being interviewed by the people who do it. Whereas my ACF London pediatrics interview, I mean, there was without a doubt no one on that panel who I was ever going to work with in a short space of time. So you don't necessarily have to play your answers to the panel. The caveat to that is that if you do know who's on the panel and you've been told, then it is very sensible to learn what they like, or not what they like, but what they are very knowledgeable about. Because if you're accidentally or intentionally going to give a presentation or give an answer related to their field of interest, you probably want to make sure you've read their papers or what their field of interest is, so that then you can anticipate that. I appreciate that many of the ACF interviews, there may be 2 or 3 panels and you won't know who's on it. So that is the default. Imagine it's completely anonymous. You don't know them, they don't know you, you won't work with them, they won't work with you. And that's usually how it goes. I think that this point is particularly important. Very, very rarely have I been surprised by a question in a interview. The wording can be surprising, but what they're actually asking, it very rarely strays far from what you would expect. Of course, on the NHL website, they do give you 6 or 7 example questions, and the panels will in some way have to touch on those. But if you've prepared a pretty long list of questions, then you can have a reasonable degree of confidence that what you've prepared will be, in one way or another, what you're going to be asked. And then finally, in general, for these interviews, the interview counts more than your CV or your shortlisting criteria. So performing well does matter. So if I was going to kind of summarize then what to say, but in general, you need to say everything you want to be scored for. You can't just say, well, I mentioned this in my application, therefore I'm not going to talk about it now. You absolutely have to say it in the interview as well. Talk about your highest level achievement. This is, I think, the same as what I'd suggested for the actual applications, but if you have an international something or you have a paper, talk about that rather than your national paper or your national presentation. Anything that makes you stand out more than other candidates is good. And then for everything that you claim or say is true, you need to provide evidence for it. So example, you say, well, academic pediatrics is a academically challenging specialty because it covers all of the different medical specialties, plus I'm trying to take on an element of research, and the reason that I feel that I'm good for this is because I have this, and this in my CV. And you can then apply that across all kinds of questions like, well, why do you think you would be a good researcher? Well, I know I'm meticulous because when I did this project, I had to screen 300 papers for their risk of bias, and we had dual data extraction and we had 95% concordance, and this required a high level of attention to detail, stuff like that. So provide evidence for everything. Even then, when you get to kind of more abstract traits like pediatrics, sorry, all my examples are going to be related to pediatrics. But for example, if you say, what would make you a good pediatrician, or what would make you a good academic pediatrician, one aspect is strong academic aspect. Another aspect is good communication skills. For example, I know I have good communication skills because one instance when I was speaking to a mother whose child had been affected with functional abdominal pain, I was able to discuss why this may have occurred, address some of her anxieties, and she was able to leave feeling better. And I feel that my communication skills helped this. So providing evidence makes it sound much more concrete than just saying, I'm a good communicator. In terms of how you deliver your answer, I suppose this kind of links into that, but if possible, try to give complete answers. So it is hard if you haven't prepared to sort of, the moment you're asked a question, think of, this is what my entire answer is going to be, and this is going to be my summing up sentence. It's much easier if you've just given a prepared answer and you're just regurgitating it. But for example, if you've got why are you applying to this job? Well, I'm applying to this job in Birmingham, for example, because it has one of the largest pediatric liver unit. I'm applying to this job for three reasons. One, because it's the largest academic pediatric liver unit. It's not King's, probably is, but you could say it's a very large academic pediatric liver unit. I feel a strong affinity to Birmingham because I was there as a medical student, and I'm interested in its special MRI capacity, and I've been in contact with Professor Jones, and we'd like to work together on a project. And for these three reasons, this is the place I want to work. So if you can draw like a clear end to your answer, that sounds much more slick than saying, and yeah, which I know sounds really obvious, but a lot of people end up doing. You will no doubt have read the various books on answering interviews, and there is a system for each question type, like how do you answer your questions about yourself, where you're going through clinical, academic, management, personal, and how you deal with a problem person. Your colleague turns up drunk. You're going to assess the situation, and then look for patient safety, and then get more information, blah, blah, blah. You need to know that. It helps you plan your answers. It's written down, just Google it. And then finally, any tip for effective communication should come in here. So trying to minimize your ums and ahs, trying to give eye contact, even though it is via Zoom. I assume it's virtual, most of these. Try to practice looking directly into a camera rather than looking elsewhere, and speaking fast enough, but not too fast, and then only saying what's necessary. And interview practice is really what will help with that. Simplifying your answers and simplifying the information you convey is important, and simplifying it to giving out the most important points is key. So I suppose I tend to, before every interview, I would think, what are the three things that, it doesn't matter what they ask me, I'm going to tell them one way or another. And I will not leave this interview without telling them that these are the three most important things about me and why they will want to appoint me. And you have to shoehorn them in, ideally as early on as possible, so that it kind of wows the interview panel. So focus on the most key points. This is the cover from a book called Essentialism, which is very good. So in terms of preparing, I realise some of you got your interview this week, so I don't want to make you too worried if you haven't already done this, but I would write a very long list of questions of which I thought were probable for me to get asked. I would write out my answers for every single question, most of them in bullet point, but the ones which were I was definitely going to get asked, I would write out in full. I would then practice saying them aloud as many times as necessary, and then I would do a whole series of practice interviews with of kind of a range of formalities. Like, you know, I'd ask my other half just to randomly fire questions at me, kind of least stressful, and then I'd practice with a friend or a doctor or someone else who was also having interviews, and them do it. And then I'd have a few like formal practice interviews with someone who does these interviews and is of the relative, you know, a senior professor, if they're able to, or another, or a consultant, and that would be very useful. Try to stay cool. All you can do is your best, and if you prepared effectively, then you will do your best, and then you just have to roll with it because you cannot control what happens. Unfortunately, there is definitely randomness in the system, and excellent people are not always appointed to the jobs that certainly on paper they think they should be appointed to, and it is stressful. So just prepare, do your best in the day, and see what happens. So my kind of top 3 tips are: understand like the concept of, you know, the facts of it being an HS interview and structured questions. Prepare very well, and once you've done that, you know you will do your best, and then you've got to let fate take its course. So those are my kind of generic points. Has anyone got any questions at the moment? Fine. Okay. Oh, yep. Go for it. Yep. Rabani. Go for it. Rabani.
Hi, thank you. Thank you very much. That was really helpful. I just wanted to ask, with regards to the interview questions that they can ask us, is there any, should we also prepare for clinical questions like the sort of AT assessment that would usually be otherwise in a generic IMT or, for example, interview? And also like ethical scenarios and things like that. I understand that it would ideally be part of the benchmarking interviews and it's not on the NIHR example of questions, but I've heard that some people received some questions like that in the past in ACF interviews. What are the chances that this could happen, and would it be a crucial part of the assessment if the clinical and ethical questions are asked?
So in short, yes, you are highly likely to be asked some form of clinical question. Now, the format of that varies greatly. In the ones that I've done, all the like clinical academic interviews I've done, I've been asked, like, it's been a single panel, and in that panel, one of the questions has been clinical. So I was asked about management of a DKA in a child, and I was asked about management of acute liver failure, kind of standard stuff that would be expected. No big surprises. It was not challenging beyond what would be expected, and well, I don't know. I never felt like I was going to fail it on that point. I'm aware that other people have perhaps whole panels that are clinical and others that are academic. And you may have like a 5-minute clinical panel, a 5-minute presentation, and a 10-minute generic academic question type thing. So they're all set up differently. But if you have a single panel interview, yes, prepare for clinical questions. I have to say, I've never been asked a ethical type. You know, you find your colleague smelling of alcohol. on the morning at handover, what do you do kind of question in in one of these interviews. That's not to say it can't happen, but I don't. Yeah, it's just not happened to me. But definitely a standard A to E first line management of common acute problems or relevant to your specialty. I would recommend being prepared for those. Cool. And then Ghani.
Hello, thank you for your presentation. My question is around timing. So they say you shouldn't speak for longer than 2 or 3 minutes, but I think I find it quite hard to convey all the, like you said, all the important stuff that's going to hit the high yield, marks within like 2, 3 minutes without it sounding like a list of things that you've done or a list of things that you've achieved. So would you, I suppose the question is, would you speak for a bit longer and make it sound a little bit more natural, or would you actually limit it to the 2, 3 minutes and then let them ask you follow-up questions?
I mean, I would even say 3 minutes is quite a long time.
Yeah, exactly.
3 minutes is quite a long monologue. I tended to aim in my practice for nearer 90 seconds, acknowledging that I would probably hesitate and be less slick on the real day, and it would be nearer 2 minutes. And
Okay.
if I'm basically focused on what I was talking about, because there's only so much that a panel can retain. And I suppose if it's, the scoring has multiple examples of performing excellent quality research or something like that, or multiple examples of commitment to specialty or within academic or whatever it's worth. If I can give if I can give 3 examples that fit that caliber, then 3 is enough. I mean, and I probably don't have more than 3. I thought that I should pick my 3 best and convey those accurately rather than try to say I did this and then I did some other stuff. So I tended to work on aiming for 90 seconds in practice.
Thank you.
No worries. I'm sure other people will tell you different things, but that's what I went for. All right. Yep. Ariana?
I think in the sample questions, there's a question regarding unrelated research that's not directly related to your area of interest. How distinctly unrelated does it need to be? Can it be in the same kind of specialty, or does it have to be from another specialty? Or would you aim for something that's a bit more generalizable and applicable to many different specialties?
Yeah, good question. Usually I'm often asked about this. I think it has to sound plausible that you have read about it, because if you said, for me as a pediatrics training, if I was suddenly to say, well, I was just browsing the British Journal of Surgery, and I saw this interesting article about head trauma and acute neurosurgical intervention, and this was actually a randomized controlled trial, blah 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 blah, then it would just sound completely contrived. Whereas if I said, my interest is in metabolic liver disease, and there was an interesting paper looking at very low calorie diets for remission of type 2 diabetes, and demonstrated that if you eat 600 calories a day for 6 weeks, then the cure rate of type 2 diabetes is 42%, blah, blah, blah. And that was in adults and older people, then that's kind of tangential enough that it's not what I'm working on at all. I'm doing like basic science in liver metabolism that has some relation to insulin resistance, some relation to fatty liver, and this was in diabetes in adults and was a clinical trial. Then I would argue that is far enough away that is not what I'm physically working on. What I think what people expect from that is for you not to say, well, my current project is working on protein X. And so here's a paper about how protein X interacts with protein Y. That is not what they want. Whereas if you were to say, I'm generally interested in protein X as a mitochondrial protein, and there was an interesting paper looking at mitochondria interacting with endoplasmic reticulum, then and that showed this about how ER functions, and perhaps that integrates with ER to mitochondrial interactions. That gives perhaps a new insight into mitochondrial biology in general. To me, that is away from your focused area of research, but plausible that you would read about it in passing.
Thank you. That's very helpful. Thanks.
No worries. I hope everyone else feels that's reasonable. Yeah. Okay. Shall we run through some questions then? So ideally we'll need some people to be willing to volunteer to go through. Got anyone who's keen to answer a question, please? Excellent, Daniel. Great. I hope that's a hand up for volunteering. Fine. So could you please summarize your academic achievements and your personal contribution to date?
Yeah, I'd love to. So to date, I've worked extensively in academia as a medical student, specialized foundation doctor in leadership and management, as well as currently as a clinical teaching fellow at the University of Leicester. Starting with when I was a university medical student, I achieved a bachelor's in medicine as a integrated degree at the University of Nottingham, achieving firsts throughout most of my modules, including PPI, as well as neuroscience, which has been a recurring theme in my research as well as academic interest throughout. Up to the end last year of my university, I also won a number of prizes, namely my Medical Excellence Contribution Prize to the community, as well as a lifetime membership with the Students' Union for my work regarding the attainment gap between mature medical students and younger medical students, which I wanted to address. The research and social sciences behind the different entries routes into medicine. Finally, as a specialized foundation doctor, I have worked extensively regarding systems improvements such as peri-arrests. I published this peri-arrest conference abstract at the Royal College of the Association of Anesthesia, which is upcoming next year, as well as presented it at 2 international conferences, SAM Manchester 2025, and one more in the Winter Scientific Meeting in January 2026. Okay.
Great.
Oh, yeah, I was going to give a summary, but I think it's gone on for a bit too long, so I'm going to leave that.
Okay. And could you just tell us a bit more about your personal contribution in one of those projects, please?
Absolutely. So as the project lead in the Peri-Arrest Proforma Quality Improvement Project, I led a multidisciplinary team of nurses, paramedics, resuscitation officers, for 14 months from the point that the project was registered to the point in August when it officially closed, and I wrote the stakeholder analysis and project report, and have since utilized it since conceptualization to completion. I delegated roles, conducted analysis in Prism and GraphPad Prism, and also wrote the manuscript and drafted it along with my peers.
Excellent. Thanks very much. Great. So is anyone else willing to have a go at that kind of question, and then we'll go through a few, and then we'll give feedback afterwards. Anyone else? Oh, we've got, I think Ghani's hand was up first. So we're Ghani, could you tell us about yourself, please?
No, I think
you remuted. Yeah.
Yeah. So I
The question would just be, can you tell us about yourself, please? Oh, fine. Move to the next person. Sorry, no worries. Hamza, you had your hand. No worries. You had your Hamza, are you still there?
Yeah, I'm still on the call.
Okay, cool.
So I might just turn it on because I find it easier to speak to a face than I do
Thanks.
a screen.
Can you tell us about yourself, please?
Yeah, so my name's Hamza. I'm currently an academic foundation doctor working in the West Midlands in medical education. I'm in my F2 year. My research interest and academic interests in obs and gynae. So particularly my research interest looks at disparities in medical education and in the clinical scenario for women's health. And then my clinical interest again relates more into the reproductive side of medicine. And outside of medicine, I enjoy tutoring, widening access to medical education. And I work with some teams, particularly at my old university, to widen access to healthcare careers. And then outside of that, I'm also a keen boxer and hockey player, better boxer than hockey player.
Very good. And what would you describe as your greatest achievement so far?
My greatest achievement was probably my intercalated BSc. So it was in reproductive and developmental sciences. And initially, I set out the goal that I really wanted to achieve it first because I would be the first person in my family to graduate with a scientific degree. And I remember during my first ICA, so our first in-course assessment, I got a 2-1 and I was extremely disheartened. But throughout that time, I managed to learn from my feedback, reflect on it, and work with not only like my colleagues, but my supervisors to smash the rest of the in-course assessments and end up with the first class honours. So that, for me, represents a great amount of effort and energy I had to put in to get that. It wasn't something that came naturally to me.
And how do you think that will pay forwards in this job you're applying for?
Yeah, so I think the academic clinical fellowship in its very nature is challenging. You're essentially juggling 2 jobs, trying to achieve clinical and academic requirements in the same amount of time as your fellow non-academic trainees. So I think the skills I learned in terms of time management, reaching out early to your supervisors and forming a good structured timeline and plan is the key to success.
Great, thank you very much, Bab. And then, Ghani, are you back in the game, or should we ask? I think Rubani.
does that sound better?
Yeah, sounds great.
Yeah, cool.
Could you tell us what 3 things you're most proud of, please?
Of course. So the 3 things that I'm most proud of. So from a personal perspective, one of my greatest achievements is captaining the England school team at the under-18 level. This required a lot of self-discipline to carry it out alongside my my academic studies. And I was one of the first people within my college to represent the national team. So from a personal perspective, I'm very proud that I've managed to keep my involvement in football going, despite a busy clinical workload. From a clinical perspective, I've managed to be involved in a variety of clinical projects throughout London and ENT. I suppose being able to interact with a wide variety of patient demographic and ensuring that they're appropriately treated, and this has been documented in both objective and subjective feedback that I've received on my portfolio. I think from an academic perspective, my proudest achievement to date has probably been my intercalated degree, which I was awarded a first for. It was in clinical pharmacology. And as part of that academic degree, I was able to contribute to a large randomized control trial, generate 3 co-authored papers from it, as well as a national prize.
Could you just briefly tell us what those papers were about?
So the research project looked at the anti-hypertensive effect of dietary nitrate in the form of beetroot juice, as well as its effect on vascular remodeling. Those were the first 2 papers were published were looking at the biochemical pathways in which it achieved the vascular remodeling and the anti-hypertensive use, and the last paper is looking at its effect in actual real-world clinical practice. So over the course of 16 weeks, how it's managed to contribute to sustained anti-hypertensive effect without any tachyphylaxis.
Okay, thank you very much. Great, thanks guys for going first. Well done, you've obviously all got lots to say. So I hope you don't mind me giving feedback outright. I will try to be polite. So some generic things that I think for all of you interesting, given the kind of previous chat about answering too long. All of your answers were, I would say, certainly not too long. Most of you could have talked for another, I think, another 10 to 15, 20 seconds without it feeling too long. Most of your answers were between a minute 10 and a minute 30. By the way, anyone else who wants to jump in with various feedback, please go for it, because I shouldn't be the only opinion in the room. I think that for all of you, it is helpful if you can have. I know this is a really weird, like artificial scenario, and I don't know you, and I don't know what job you're applying for, but there needs to be like a really clear theme almost through every single answer of why you're applying to this specific job. So, for example, when I applied to ACF Pediatrics, if I'd been asked, tell us about yourself, or what are your achievements to date, I would have said, well, one of them was that I came top in medical school and I graduated with how many 7 prizes and stuff, which included the pediatrics prize, and I came top in pediatrics, blah 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 blah. And then I did various projects. I have this many papers, which included a pediatrics paper, blah 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 blah. And like absolutely every time hammering through, I'm doing academic subspecialty. There's no doubt about it. I've always wanted to do this. I know that's not how it is in reality, and you're allowed to choose something different, and life moves in interesting ways. But for the purpose of the game interview, just make it sing clearly to someone who doesn't know you that this is everything you want in your life, is this academic job in this specialty. And I think, Hamza, that came through most in your answer, that like I got what you were interested in and what you wanted to do. So that was good. Try to hit us with as much data as at the start as possible. And I think, Daniel, you gave like an opening sort of summary of I've been involved in research and academic throughout medical school, blah blah blah. That was good. It would have been just nice if you'd hung on the end of that. including publishing X many conference abstracts and 7 national or international presentations. And then you go into the detail and explain it. So that would have that I'm sorry, maybe you did say that and I didn't hear. It's possible, by the way, I may zone out at times. So, but that kind of thing would be good. Then like another thing that I think for everyone is, I don't have a good solution to this, but getting the correct level of detail in your answers is difficult. I would say that almost all of you were thereabout correct, and by which I mean if you're trying to explain a project. So I'm particularly proud of this abstract because it got published, and I got to present it nationally, and it was about testing this compound in this cohort, and we found this, and the implication was this. Like for example, Garni, at the end, I thought, you know, your little summary with the follow-up question about what it was about, that was a nice succinct description for like a follow-up question. And I think, yeah, more or less all of you got the right level of detail for describing things in details. This is the kind of context for an answer, so that was nice. Another thing I think that more or less would apply to almost all of you, Hamza, I asked this as a follow-up question, but would be kind of integrating a sum up line at the end of your answer as, in this, you know, based on this, in this job I will blah 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 blah. So for example, I have I'm proud, or in my history I've done this many projects, this one of which was this research study which I led from start to finish, did this data analysis, and we presented. In this job as an ACF, I will take these skills, following it forward. I've shown my determination, and I will lead to peer-reviewed publications and a competitive application for fellowship funding for a PhD. It's nice if you can lead it with, I've got this is what I've done, and this is what I will do in this job. It's like a nice summary line. Yeah, those are my main points. You will, without a doubt, be asked some generic, tell us about yourself, who are you, what have you done, question. I think I would say, if I was, the one I've been asked the most times by wording is either what are you most proud of, or tell us about one of your achievements, or tell us about 3 things, more so than like a tell us, summarize your achievements. It's more often what are you most proud of, or something like that. So be ready for that question, and that's a question you should just know immediately. The other way it can be phrased is things like, why would you be good for this job, or why would you be a good academic pediatrician? And of course you need to approach it in a slightly different way, but essentially it's like the most open question, and you can tell them anything that is important about you. So yeah, when if you're kind of pinned down to it, like I asked Hamza saying, you know, or sorry, like I asked Ghani saying, you know, what are the 3 things, then you rattle off 3 things. But if you're often asked tell us about yourself, then it is sometimes tempting to say sort of a life generic stuff, but really focus on, these are the most important reasons why I would be excellent for this job, and get that out there at the start. Any questions or thoughts on any of that? Fine. We will move on to some other stuff then. So I imagine many of you have been asked to, or will be asked to, look at some sort of data or abstract or paper. Is that fair? Does anyone happen to have one that they have already prepared and want to go through? Fine. I have something which I can just briefly show you and talk about how I would sort of try and approach this thing. So let's get this up. So I do the ESPGAN podcast journal club, which is the European Peds Gastro Liver Society podcast. Get it on your favorite streaming platforms. And so I went through this paper recently, so I'm kind of aware of it. But it's the kind of paper that you might feasibly be given, and the way that I tended to prepare for these, obviously there's sometimes you're asked, please pick a paper, prepare it, fine. The other one is you may just be given a table. I'm aware of that. Sometimes you're just given a data table like this, and that's all you've got. And then others, you're given an abstract, and then you read it and present it. Anyway, the crux of it is being able to give a succinct summary. So, you know, for example, you could say, and you may be asked to give a scientific summary versus being asked to give a lay summary. So the scientific summary would be that this study is a non-randomized cohort study called VIDO Kids, which studied the use of a novel treatment for inflammatory bowel disease called vedolizumab, which is a biological agent used to treat severe inflammatory bowel disease that's not responsive to other treatments. This treatment, vedolizumab, is already used in adults, but there's limited data on it long-term in children. So this study is a prospective multi-center cohort study which studied just under 150 children who had had vedolizumab, and most of them started vedolizumab 2.5 years into their inflammatory bowel disease after having had multiple previous treatments, and they were followed up for at least a year on average. Patients with ulcerative colitis responded more frequently, nearly 40% achieved remission, whereas those with Crohn's disease were less likely to respond at about 30% achieving remission. There were the authors described tolerable levels of adverse events, though I do note that one of these included a severe form of vasculitis, which I would like to learn more about before I conclude this myself. One of the main criticisms of this paper is that there was no randomization, and it's unclear whether the study cohort is going to be truly representative of the patients who'd be receiving this, because the patients who would typically be receiving this are those who would have already failed multiple treatments, whereas in this cohort it seemed more opportunistic. However, the authors conclude that vedolizumab has got efficacy in children for treatment of inflammatory bowel disease, and therefore that supports its licensing for this use. And that's the sort of length that I would suggest. If anything, that's probably a bit long. I haven't practiced this really, so but that's the sort of length from a scientific perspective. Alternatively, you may be asked to summarize it for a lay audience, in which case you may say something like inflammatory bowel disease, or IBD, is a... Oh, sorry, go on. Yep. Ariana said How much time would you spend on this question? It depends. So how much time would you spend on this? It depends what the setup is. Sometimes I know one of my friends has got like a whole station on the paper they've prepared, and they have to do slides and everything. So that's very different to you've been given an abstract and then you've been asked about yourself, and then you've been asked about your previous research, and then they say, tell us about the abstract, and then they're going to ask you about how you treat diabetes. If it's like just a question in the middle of a panel interview, 2 to 3 minutes to summarize the paper. And I would definitely describe the paper in some way or form, because it slightly depends. But I would definitely describe the paper one way or another, because the panel need to see that you've understood the paper, not just that you've looked at its inclusion and exclusion criteria. Of course, if they asked you, please, can you give us your critique of this paper, then it probably would be a bit different. I probably would then say, this is a non-randomized cohort trial of vedolizumab in children from 142 patients internationally, and it showed moderate efficacy of between 30 to 40%. The main strengths of this paper are this is novel. It's a multi-center cohort. This is published in a well-respected journal, and they've clearly outlined where it fills a evidence gap, and this is sort of a follow-on from a previous study. The weaknesses are that it's non-randomized and therefore open to bias. It may also not be representable. I think that given the relatively small population, you can only draw limited conclusions on the risk of adverse effects. That's probably how I would weight it if they asked me more specifically about the strengths and weaknesses. Does that seem reasonable? But if they said, just tell us about this paper, I would do a little bit more, well, describing the paper and proving I understood it. Yeah, and then similarly, you could be asked, can you give us a lay summary of the paper? And well, if that's the case, then I would launch into saying that inflammatory bowel disease, IBD, is a condition where children are unfortunately affected with inflammation in the bowel. This can leave their bowel scarred and bleeding and give them abdominal pain, and they struggle to gain weight. The treatment for this are medicines that dampen down the immune system. One of these is called vedolizumab, or Vedo for short, and that is used in adults. But this is the first paper to see what happens when you give Vedo to children for more than a year. And here, lots of different doctors from multiple different hospitals over the world looked at nearly 150 children who'd had Vedo for IBD and who'd had it for more than a year. They found that just over 1 in 3 treatment children who were on Vedo were improved, meaning that they could come off their other medicines for IBD and they had no more inflammation in their bowel. The main good things is that this is a new piece of data, and hopefully this means more children will be able to use Vedo. The downside is that this was just all the treatment, all the data kind of collected together. There was no randomness involved, which means that there is a possibility that these results were just found by chance. And it would be better to have a study where people had been compared Vedo to a dummy drug, also called a placebo, and that would make it a better quality study. That's probably how I would approach a can you explain this to a layperson type question. Any other comments or questions about this?
How do you make your lay summary not too long? Because that's something I've been struggling with, because it's quite hard to try to get something so scientific down, digestible, but also not kill too much of your interview time.
Yeah, miss stuff out. You just have to decide what's important and then cut out everything else. I think it helps if there is it depends on what the paper is. If it's something really esoteric that needs a reasonable amount of explanation, even to start talking about it, then it's quite difficult. So, there's various genetic liver conditions, and if it was a paper about one of them, then it would take quite a lot of discussion even to get there, because a lot of people it would be quite hard to explain even what the liver does in the first place, to then get talking about what happens when you store excess glycogen in the liver, blah, blah, blah. That would be quite hard. But my short answer is you've just got to pick fewer things to say. That's the easiest way to make your answer shorter. I'm not saying it's easy. Everyone knows it's hard, so just do your best. Yeah. Other questions about papers and presenting data?
Sorry, I've got another one.
Yeah, go for it.
Can I ask, how much appraisal should you do? So if whether you're summarizing or critiquing it, would you say that 3 strengths, 2 or 3 weaknesses is enough? Or
Yes.
because back when we were doing the AFP, it was like a whole section of the interview where you could essentially talk for 10 minutes about appraising a paper, but how much would they want at this level?
It depends on the setup. If it's like appraise a paper or give your comments as part of a single panel, like you've described, then 3 is a nice number. I always go with 3. Just pick 3 things, go with it. As long as they're good. Like don't give them 3 rubbish bits, 3 rubbish comments, but 3 good comments. That's fine. You're right, it's different. A friend who's done an AFP recently, and she had a 10-minute presentation on the paper, and obviously you need to go into a lot of detail then and explain why you think that this specific inclusion criteria means that the study is biased and the potential implications for that on the data, blah, blah, blah. Yeah, 2 or 3. And I think that's fine. That's what I'd recommend. Okay, cool. So that is a bit of a few suggestions about papers. I can't remember if I already said this, but the way that I tended to practice for this, again, it depends. If you've already been given a paper, then fine. If you're going to be given one on the spot, then I would just go through PubMed and I would search trial, because usually they're relatively clinical stuff you get given, and then just read through abstract after abstract until there was one I didn't understand. And then when I didn't understand it, go away and Google it or ask someone about it. And I found that helpful. Yep, Rabani.
Hi, thank you for the example. That was really helpful. I just have a follow-up question on at what point do we know whether we are going to be asked to critically appraise our own paper, or whether we're going to be given a paper on the spot, and whether it's going to be 10 minutes before, the day before? Do we know that at the same time they send us the invitation for the interview, or is this something that we have to sort of know beforehand by doing our own research? Because I'm not sure. so we can
I think
like
that
practice with.
I think that every time I've been asked to assess data or a paper, I've been told well in advance of the interview that it would be a component of it. I can't remember if it was on the actual interview invite or it was a week before in the this is exactly what the interview will be like and this is the panel and this is the rough setup. It was definitely not like a surprise on the day. Yeah, I was always told with a suitable duration of time.
Okay, so I mean, it's fair to assume that we will be like known beforehand, as opposed to something that's like we're gonna be like we'll be informed in one way or another, as opposed to like it's something, because I wasn't sure if I was not informed, or something that I have to look further into. But yeah, that's fine. As I'll
Yeah,
keep an eye out for
the only
like that.
the only thing I will caveat that with is the classic interview question is tell us about a paper you read recently, and I really hope you're all ready for that question because it comes up in every single interview, and I don't know. Apparently, it's quite a good differentiator. Anyway, so you have to be ready for that, and that is slightly different to the question someone asked earlier about, tell us about an aspect of basic science research that excited you outside of your immediate area. Blah blah blah. That's like just a generic. Tell us about a paper, and that question obviously they can ask you, and then they could say as a follow-up, what do you think the strengths and weaknesses of that paper would be? And that's one way that they can get into a critical appraisal of a paper without having to give you a paper beforehand, get you to do a presentation, give you data, blah blah blah. So that would be my one caveat to that answer.
Yeah, thank you. That's a really good point. And
No
I
worries.
also like how you also prompted us to like to sort of make it sound like we've come across this paper organically as as something that is somehow related but not quite to the area of immediate interest. Yeah, thank you. That's really helpful.
Yeah. So I mean, I guess I'm pretty sure I had two papers prepared for the academic interviews, like one that was specifically related to what I was working on, which hopefully wasn't too hard, and then one which is slightly tangential in case they asked, tell us about something unrelated. Prince Joseph.
Hi, thank you for your presentation. I just wanted to ask, so if I'm applying for a job that's specific to a specialty, then will the critical appraisal be a paper that's related to the specialty, or can it be anything?
I would expect it would be vaguely related to the specialty. I'd be very surprised if it weren't.
Okay, cool.
It may not be bang on, but it would be something related. So, for example, if it was respiratory job you're applying for,
Yeah.
It may not be like a randomized phase 2B of idiopathic pulmonary fibrosis, but it could be a general practice paper around asthma.
Okay, cool.
So
Makes sense.
They won't necessarily have pulled it from the top tier journal within the last month, but it probably will be in the right field. It would be pretty unfair to give you something else. Whereas for the academic foundation program, it can be anything.
Yeah, cool. Thank you.
Right, let's just go through a couple more questions. If we've got anyone else who's willing to answer something. Great, Janapriya. Could you tell us about what area of research interests you most, please? you're still there. Maybe they've gone. Okay. Anyone else? Yeah, go for it, Rabani. Can you tell us about what area of research interests you most? Oh, she's back in. Fine. Rabani, you go for it. If you're keen.
Yeah. Yeah, I can give it a try.
Yep.
So I would say the areas that I'm interested in within renal medicine include chronic kidney disease, as well as ANCA vasculitis and IgA vasculitis, and as well as IgA nephropathy, and that is showcased by conferences that I have attended related to these diseases. For example, a conference in 2024, KDIGO, on ANCA vasculitis, as well as a recent IgA conference that was held in Birmingham that has summarized the recent randomized controlled trials on IgA nephropathy management. I've also underwent a renal clerkship in one of the biggest surgery hospital in Bahrain that has given me an opportunity to treat CKD, and I've attended outpatient clinics where I've also managed CKD in an outpatient setting, and following up with their proteinuria level and medication adjustments. And I've also made effort to get in contact with people who are a big expertise in the field in Birmingham, where I'm applying to express that interest of mine, and I have planned potential projects that I could work on during the academic clinical fellowship, should I be accepted.
Could you give us an example of one, please?
Sorry, what was that?
Could you give us an example of one of the things that you'd had in mind to work on?
So one of the things that Professor Dr. Chalouzas is working on at the moment, for example, is CMV reactivation in ANCA vasculitis patient. And I was hoping to look specifically in CMV activation in ANCA vasculitis patient within patients with a recent VTE diagnosis, including PE or VTE, because of the increased risk that they are exposed to. Yeah.
Okay, great. Thank you very much. And oh, John Priya was here, and then they have gone again. Anyone else who's willing to answer a question about kind of their research? Hamza, I'll come back to you if there's anyone else. I know you just because you already have before. Anyone else? Great, Hamza. Could you please tell us about your research plans for this ACF?
Yeah, so my area of interest is particularly looking at reproductive endocrinology. So in my integrated BSc, I analyze a large data set looking at polycystic ovarian syndrome. So polycystic ovarian syndrome is the leading cause of anovulatory infertility in premenopausal women. It affects 1 in 4 women, but actually the data is lacking within the field. And we know it disproportionately affects Black and brown women, yet these groups aren't represented in our research. So particularly at Aston, what I would want to look forward to is utilising the demographic where we're situated. We're in the West Midlands, we're in one of the most ethnically diverse populations in the UK. And I know one of the research areas of interest is looking at how GLP-1 agonists could be used in women with polycystic ovarian syndrome to potentially increase their chances of conceiving. So I'd want to work with some of the leading people in the field, such as Professor McCall, and initially start with a systematic review. There's very little known about how GLP-1 agonists in particular act on women with polycystic ovaries and the impact that may have on fertility, and then work with her and our local trusts nearby to think about recruiting participants for looking at the impacts of GLP-1 agonists on things like weight loss and then reproductive outcomes.
And where do you see this leading?
So yeah, my initial research from when I was an undergraduate essentially recommended changes for the way that we manage women and stratifying them based on ethnicity. And I'd want to envisage more personalized care for women who are suffering with polycystic ovarian syndrome. So I can imagine this hopefully leading to changes in clinical practice. At the end of the day, our research is supposed to end up having some sort of tangible outcome for the patients that we have. So hopefully, potentially an alternative pharmaceutical management for women who suffer with this condition.
Great. Thanks very much, guys. Yeah, so again, I expect you can bet in one way or another you'll be asked, what do you want to do while you're here? What kind of research do you want to do? How does your work align with the interests of this department? What is your main field of interest? Something like that, which is basically asking you, what do you want to do? What are you actually going to do during the research? And again, you kind of just have to see through if they ask you, what field of interest research you're interested in, then it's not like asking for a broad, well, I'm kind of interested in this and this and this. Most people want, I'm interested in this, like I'm interested in just steatotic liver disease, previously known as fatty liver disease. And therefore, I have come to Cambridge because they have a big unit working on insulin resistance, and insulin resistance is the main driver of fatty liver disease. And I think the first thing you need to say about after saying I'm interested in this is because, or like, this is why I'm most interested in it. And of course, there'll be evidence that goes behind why you're interested in it, but the first step should be, I'm interested in this because blah, 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 blah. I just think the science is conceptually fascinating, is a totally acceptable answer. Then it's kind of just a stepwise thing. Like, I'm interested in this because of this. I've demonstrated my interest in this through X, Y, Z, and I like the points you made, Rabani, to that. And then, you need to follow up with, to follow up this interest during my ACF, I will use my time to X, Y, Z. And you know, Hamza, you presented a very clear plan. You could even be more specific and say, I anticipate that this will take the first year and a half to complete the systematic review. or something like that, depending on how you see your time going. Or over my 9 months during the ACF, I anticipate that this work will take at least 6 months. I will use the latter component to start writing a fellowship application to NIHR to apply for PhD funding. And I kind of would suggest that that's got to be the outcome from what you're saying you want to do. Because I'm interested in this, I'm not going to get a Nature paper during my ACF, or like, well, you might, but not in 9 months. But I'm interested in this, so I'm going to do this. And the aim of that is good quality data to go into an application to NIHR or MRC or BHF or another charity or something, CI UK, to get funding to do a PhD. And that is like, that's the answer. Unless you've already done a PhD, in which case, you need to articulate that and kind of what your next steps are then, because that's also complex. So I think trying to be specific. You both mentioned why that interest aligns with this region, and I really like that. I think that's extremely important, and how that links into an individual group or group's plans, and that's really good as well. So that's great. What people often ask is just how specific do you have to be about the research? I think you don't have to be nailed down like exactly what the systematic review question is going to be. I think it's totally fine to say I'm interested in GLP-1 in PCOS, and we want to do a systematic review to understand the data. That is fine, I think. Similarly, I think it's fine to say I'm looking at CMV reactivation in the context of this vasculitis. That's great. The only thing that I wasn't totally clear on, Rabani, is whether you were talking about a wet lab science project or whether you were talking about a clinical translational study. Yeah, so yeah, that was another point I was going to make. It'll come back to me. Fine. Hamza said, naturally talk fast and get nervous when I speed up. Any tips? Don't think I have any particularly insightful tips beyond practice and don't do it. I'm sorry. Only practicing in front of people, lots of people, and getting them to tell you and stop you and say, you're talking too fast, I can't understand you. I have to say, in those answers there, I thought you were talking at a completely appropriate speed. You didn't come over as fast as some people talk. So that was fine. But practice in front of people who you trust will tell you when you're doing something wrong would be my main top tip. Good. So that kind of research what you're going to do question you need to be prepared for. And then the final question that we're going to go through, which again, I will bet my bottom dollar you're going to be asked, is something about clinical versus academic balancing. Another question. Sorry, just another question in the chat. When talking about research interest in, if you'd like to do wet lab work, will it be worth acknowledging you will also be clinical and likely get involved in QIPs, and acknowledging that's important too? If you're planning on doing wet lab work, kind of either way, I would recommend saying you're going to be focused on what your main thing is. I would not recommend saying, I'm interested in studying, as I did, adipose tissue and its relationship to insulin resistance. But I also think that I'll probably end up doing an audit on child protection issues, because that's what I need for my, well, I'll end up doing an audit on child protection issues, and I'll also end up doing a systematic review of head injuries in children, and I'll end up doing this and this and this, which is almost certainly what will happen in real life, but that sounds terrible in an interview. It's best just to say, I am here because I'm interested in mitochondria, and I'm going to use my ACF time to work hard to get good quality data to put in an application for a high quality PhD. And that is all that matters for the purposes of this interview. Whether or not you do a quality improvement project matters diddly squat to this kind of panel, in my mind. In fact, the more you say you're going to do, usually the less focused people think you are. They feel like your mind's everywhere. You have no clue what you want to do. It's best just to say, I am most interested in this. This is what I want to do. And then that's fine. Cool. So, do I have any volunteers to answer a question about balancing clinical and academic responsibilities? Great. Thank you very much, Nishita. So the way that they've worded it on the NIHR website is, what do you see the challenges of balancing clinical and academic roles? Can you give us an example of how you've overcome these challenges in your career so far?
So I see three main challenges in balancing clinical and academic roles. Firstly, keeping up with clinical competencies on the same timeline as my full-time colleagues, using limited research time productively, and managing competing expectations from both my clinical and academic supervisors without burning out. I've already experienced a version of this during my academic foundation program. So whilst working on a full-time rota, I contributed to and was an associate PI of an NIHR funded multi-centered randomized control trial. I've led a prospective clinical trial on foot osteomyelitis and the use of an antibiotic antibiotic filler called Ceramint. I've published 3 papers and presented one internationally. And I did all of this without having my dedicated research block yet. To manage this, I used my protected pockets of time, so 0 days and evenings, but I was careful to make that sustainable by planning ahead with my supervisors. We staggered deadlines across projects and were explicit about what was realistic in each rotation. And I also broke down large tasks like a manuscript into smaller milestones. In addition to this, in medical school, I published 10 research papers with 4 being first authored, whilst also ranking in the top 10 of my year and getting involved with multiple teaching projects. I used practical approaches such as calendar mapping, weekly goals, and regular reflection. Looking ahead to the ACF, I know that 25% of research time won't deliver a whole programme, so my plan is to front load the groundwork and use my early clinical months to write protocols, prep ethics applications, and do systematic review work so I can use my protected time to immediately collect and analyze data. And also I will ensure that I keep up with hobbies. I really enjoy dancing, so I'll ensure that I continue with that so I have a balance.
And what will you do if your clinical team is asking you to do if your clinical team is regularly asking you to cover shifts as an emergency on time when you should be doing research?
So I would look first of all at my contract and what I've agreed to before I start my ACF, and then I would approach my academic supervisor as well as my clinical supervisor, and explain the situation. If that does not deem to be successful, I will escalate to the program director.
Okay, thank you very much. Yep, great. I don't know whether you've thought about that in the past, but yeah, that's definitely a question that you need to be prepared for and have like a range of answers that you can pull out and examples you can pull out depending on the exact wording of the question, because every single academic interview I've done, I've been asked one of those questions in one way or another. So you need to know it. And actually, having been on the panel for a few, it is a surprisingly differentiating answer. I guess I would have always thought like everyone's preparing for it. It's just a bit of waffle. You just say the answer, but please do take it seriously. I mean, I guess Nishita, in the interview, you probably would have said many of the bits and bobs about your background and achievements in previous answers, so you wouldn't necessarily have to recover all of those. I certainly liked when you said acknowledging that a challenge of it is avoiding burning out by trying to do both. I have to say, it did feel that that was slightly then felt contrasted by the fact that then you'd describe the fact that the way you'd achieve so much was by using your 0 days and off days and evenings, which is of course what we do, and that's how anyone who's a clinical academic gets stuff done. You just got to be careful how you say it. I certainly liked the description of sort of front loading tasks, and the other thing that people can say is acknowledging that certain things like ethical approvals take time, so you get those done as soon as possible, so that by the time you come to your research block, it comes out. And the really important thing that you said, that you would just be astounded that people don't say in interviews, is that if there was a problem, I would ask my supervisor for help. I know it's so obvious, but don't forget it. Like, if you're talking about clinical academic difficulties, I would just jump in there even in your straight answer and say, it is challenging and there is a conflict. I would never leave patient safety at risk, but I must protect my academic time, and I will, if I feel that my academic time is being encroached upon, I will go to my academic supervisor for support and ask them to liaise with my clinical team on my behalf, and escalate to the program director, exactly as you said. So that is spot on. I have even been asked even more kind of inflammatory questions like, what's the wording? How would you respond to a clinical colleague who said, you're not a real clinician, you're just a part-timer and someone who works in the lab? But that, to be fair, that was in an ACL interview, so I think that they were trying to be a little bit more, I don't know, challenging or something like that. But again, the essence is they're asking the same thing. It's how do you balance clinical academic stuff? Super. Any questions about that aspect? Fine. To be honest, I think that those are probably the main bits. I have a very long list of questions that I prepared, but those 3 or 4 bits are the crux of it, and getting those really good. Variations on those, it may feel like you're repeating yourself in various answers. That's okay. Has anyone got any other questions they wanted to ask? Yeah, Hamza.
So my question was just on graphs and figures. Do you have any advice for maybe figures that we don't see as often, like forest plots, Kaplan-Meier curves? Is there any particular Resources is just reading lots of papers and analysing them to get confident with figures.
Well, reading lots of papers and analysing them is only useful if you know you're reading them and analysing them correctly. So I think if you're unsure if you're interpreting it correctly, you need to find someone who knows what it's about and then check that you've got it right. Yeah, but other than that, I just went through loads, but then I looked it up if I wasn't sure. Yeah, you need find people you can ask who you think will know the answers. Nishita? Nishita, go for it. You're muted.
Oh, sorry, I didn't realize I was
No
muted. Thank you very much for the session. It was very useful. I've got two questions. So the first one being, do you think every ACF interview would sort of follow these rough questions and like the content and mark scheme, or do you think that they would ask anything out of the blue?
I think that they will cover all those topics. I think the wording will be different.
Mhm.
And I don't remember being asked anything that I'd never thought to prepare. I mean,
Okay.
you know, I've shared my kind of interview questions before, and on there was a very long list of stuff.
Mhm.
And
Okay.
I may have been asked something kind of weird, like, what do you see the role of an academic clinician in the MDT? You know, something a bit weird, or can you tell us what you understand by evidence-based medicine? Which is a bit left of center. I prepared it at some point.
Okay. Perfect.
It
Thank
wasn't
you.
like it technically it wasn't exactly on the mark scheme, but I think the people setting the interviews have to follow roughly this schema, but they can set additional questions or other questions that they feel will help inform those points, as long as obviously they ask them to every candidate. I think that's how it works.
Okay, thank you. I was just wondering if I needed to like maybe think outside the box in terms of my preparation. But that was really useful. And then the second one is, how important is it to have spoken to someone on the department? Because I'm applying to two ACF programs, and one of them has been extremely useful in terms of I've managed to have like two pre-meetings, but the other one, I've sent an email, but it's just been ignored. So I haven't heard back from about interviews yet, and I don't think they've been giving out interviews yet. But do you think that would disadvantage me? Do I send more emails or just leave it? I don't know how to play that.
I think that sorry. I think it doesn't matter as long as you can clearly articulate why you want to apply to that place and region, because most of these are regional jobs, aren't they? And how your interests align with what is available in that area. You don't have to have a supervisor set up. You don't have to have had a pre-meeting, but you need to have some rationale. So, when I applied to East of England, I said, I'm applying here because I'm interested in insulin resistance, and there is the Institute of Metabolic Science here, and there are a large number of PIs who work on this, and I want to meet with them and discuss potential topics. And I think I may have even said I'm particularly interested in the work of these two or three people, and I'll be seeking to meet with them once I'm hopefully appointed to this job. And I think that's acceptable. Alternatively, I'm sure that there are people who turned up saying, I've already met with Dr. Jones and we've mapped out this project, which is also okay. but even if you've not met with anyone, just make sure you've read about them and what you're saying is plausible. You obviously wouldn't want to claim to be doing a study on a clinical cohort that didn't exist in that region or anything like that, but it probably is worth sending one more follow-up email after you're invited to interview, just to make sure that they haven't accidentally overlooked it. Some people certainly will have a policy of not responding to candidates because they don't want to be unfair.
Okay,
And
that makes sense.
bias some people. Yeah.
Thank you.
No worries. Any more? All right, excellent. Well, I hope that has been vaguely useful. I will at some point soon-ish, I guess, stick the recording online. And best of luck, everyone. Thanks. See ya.
Thank you so much. Bye.